Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today I will be speaking about what is Ramsay Hunt syndrome. But before we continue, if you are new to the channel, make sure to subscribe down below for more and more similar videos. So let's start now. Now, what is Ramsay Hunt syndrome? It is a complication of varicella zoster virus infections, including chickenpox or shingles. So if you had a chickenpox as a child, the virus that caused it, which is the varicella zoster virus, it can remain inactive or dormant in your nerves for years. Shingles, same thing, occurs when the previously dormant varicella zoster virus reactivates. The reactivation of the varicella zoster virus in your facial nerve is called the Ramsay Hunt syndrome. So here I created a mnemonic to easily remember the Ramsay Hunt syndrome. Starting with the word Ramsay, the letter R. R stands for rashes on the face. So you'll have rashes on the face, same as shingles. Second, the word Ramsay. The end of Ramsay, which is Y. Y, if you remove the straight line down, it will become V. And the V stands for the cause behind the Ramsay Hunt syndrome, which is the varicella zoster virus. Number 3, the word hunt. It stands for this syndrome. It hunts your facial nerve. That is the seventh cranial nerve. So the symptoms is based on the nerve that is hitting, and you will see what do I mean by the symptoms. Lastly, the word also hunt, the letter H, stands for hearing loss. So the patient, if the Ramsay Hunt syndrome left untreated, then he might have deafness or hearing loss might develop. So we said that the Ramsay Hunt syndrome affects your facial nerve, that is the seventh cranial nerve. And this facial nerve, it has 5 branches. The 5 branches all are affected by this syndrome. Because they are affected, so the symptoms is based on the nerves or the branches that are affected. So the patient will have loss of forehead tension, a drooping of the eyelid, inability to close his eyes, loss of the nasolabial fold, drooping mouth, loss of cheek tension. And you can see that all these symptoms, they appear unilateral. So that's why we can name, or we can say, the Ramsay Hunt syndrome. The patient will develop a unilateral facial paralysis, or in other words, paralysis in only one side of his face, and the other side will be completely normal. Now, the question might come into your mind: who does the Ramsay Hunt syndrome affect or targets? Which group of people? Ramsay Hunt syndrome can affect anyone who's had chickenpox or shingles. Most cases occur in people 60 years and older. The condition rarely affects children but has been diagnosed in a 3-year-old patient. People who are immunocompromised are more likely to be affected, and generally they will experience more severe symptoms. So in order to summarize all this talk, if you had chickenpox when you were a kid, you are more likely to have either shingles or either the Ramsay Hunt syndrome. So that's why we recommend the parents, once they give birth to their children should get the vaccine against the chickenpox in order to not develop such syndromes eventually. So what is shingles? Shingles, they are painful rashes that will appear on the body, seen in people 60 years and above. The cause behind it is previously had an exposure to chickenpox. So the reactivation of the virus, which is the varicella zoster virus, it led to shingles that will appear on the skin at the end. So here is a picture showing the course of the facial nerve. And therefore, the Ramsay-Hunt syndrome causes unilateral facial nerve paralysis, or in other words, facial palsy. And the word palsy means paralysis of the facial nerve, or inability to move one side of your face anymore because the facial nerve is affected. And you can see in the picture that your facial nerve is located near to your ears. So the patient will have also an intense ear pain. Not only that, in addition, it may cause a painful rashes on your ear, face, or mouth, similar to shingles. For people 60 years and above, if you see a patient having shingles, it will appear on their body, right? In Ramsay-Hunt syndrome, the shingles or the rashes will appear in their face, ears, or mouth rather than on their body, and it will be very painful. So here is another picture. You can see your facial nerve is located near to your ears, so the patient will have an intense ear pain. And you can remember the facial nerve by placing the palm of your hand on your face, and you can see 5 branches will pass into your face. So the facial nerve is the nerve that controls your facial muscles or your facial expression. It passes through a narrow corridor of bone on its way to your face. Now, what are the complications of the Ramsay-Hunt syndrome? Number one is permanent hearing loss and facial weakness. Why is that? Because we said that the facial nerve is located near to your ears, so the patient, if left untreated, he might have deafness. And why facial weakness? Because the facial nerve is involved, and the facial nerve, if left untreated, this will result in facial nerve weakness. Number two, eye damage. The facial weakness caused by the Ramsay-Hunt syndrome may make it difficult for you to close your eyelid. You can no longer close your eyelid. When this happens, the cornea, which protects your eye, can become damaged. This damage can cause an eye pain and blurred vision eventually. Lastly, post-therapeutic neuralgia. This painful condition occurs when a shingles infection damages the nerve fibers. The messages that is sent by these nerve fibers, they become confused and exaggerated, causing pain that may last long after other signs and symptoms of Ramsay-Hunt syndrome have faded away. Now, how to prevent yourself from having such a syndrome? Children are now routinely vaccinated against chickenpox, which will greatly reduce the chance of becoming infected with the chickenpox virus. Because if you are infected with the chickenpox, then later, when you become 60 years old, you will have shingles. Why? Due to the reactivation of the varicella zoster virus. Or you might have the Ramsay-Hunt syndrome as well. In addition to that, a shingles vaccine for people aged 50 or older is also recommended in order to prevent the reactivation of the virus again, because sometimes the virus might be reactivated, and therefore in order to stop the reactivation, we recommend for you to take a vaccine for the people who are aged 50 years and above, and especially the patients who are immunocompromised, such as the HIV patients. Now, if you have the Ramsay-Hunt syndrome, what treatment would I recommend? Number one is the antiviral drug, obviously, because the cause behind it is varicella zoster virus, so it is a viral infection, and we need to give an antiviral medication, such as systemic acyclovir. Number two, corticosteroids should be given. A short regimen of high-dose prednisone appears to boost the effect of antiviral drugs in Ramsay-Hunt syndrome. Lastly, pain relievers, because of course the patient will have an intense pain, and in order to relieve the pain, we can give him an ibuprofen, paracetamol, any of the analgesics is recommended to be given for such patients in order to relieve their pain. I am done. Thank you all for watching my video. If you enjoyed, don't forget to press the like button down below, comment down below if you have any questions, and subscribe for more videos. Goodbye now.